Hello, everyone. This is Chadi Alraies from RSH conference in Riyadh. Again, coming to you in 2025 with Dr. Fahad Alkindi to talk about atrial septal defect in adult and patients. Fahad, thanks so much for being with us.
Nice. Thank you for invitation.
Yeah. So, during recent literature and evidence, PFO and ASD are indicated for closure in adult patients.
Yes.
So, let's go over the indication of the closure and then we'll go over techniques in a minute.
Okay, sure. So the case I presented today and I shared with my colleagues in this conference, it's an adult patient with atrial septal defect, which is a defect between the left and right atrium. And actually, this defect is there since childhood, but many patients we only see them during adulthood,
Right.
and usually they tolerate this defect until late stage of their life, and they present to us in their mid 40s to 50s. And the presentation most of the time in the case of atrial septal defect is exertional shortness of breath, exercise intolerance, and palpitation. In such case, usually we investigate the patient thoroughly, and we depends a lot on the imaging, and we have a lot of technology advances now in imaging. So the gold standard always we start with the echocardiogram, and then we go further with that with using transesophageal echocardiogram to diagnose the defect. And so there are different platforms or let's say spectrum of ASD, but the most common one is the ASD secundum, which is in which we us as structural interventionists, we treat those patients
Right.
as compared to the other defects, which is usually the surgical option is the treatment. Yeah.
You mentioned something very important is the use of TEE.
Yes.
So do you always do TEE for these defects to
Yes.
measure or as selected cases?
Yeah. So actually, in both BFO and ASD now. It is a gold standard that you do TE as a pre-assessment for those patients, because you want first, in the case of an ASD, you want to measure the size of the defect, and also you want to make sure that you have enough stable and sufficient REMS, so that it's the anatomical features of this defect is suitable for the transcatheter closure.
Right.
So in addition to that, of course, we need to make sure that there is no other venous anomalies that sometimes it can coexist with the atrial septal defect. And also, of course, we plan our intervention and we decide about the size of the device and the type of the device for
Right.
this kind of defect.
So now let's move on to the techniques and
Yeah.
device selection for these closure for these defects.
Yeah. So there are different platforms of devices that is used for closure of both BFO and ASD defects. The most common one is either you go with the Amblatzer or the Occlutech, and each one has its own feature, and they have a lot of similarities, both of them. And the they are safe devices, and usually the rate of complication, if the pre-assessment and the planning of the the procedure is well done with a team approach, then the risk of complication is extremely low.
Yeah. And what kind of imaging guidance you use during the procedure?
Yeah. So during procedure, in the past, people they tend to do such procedure only fluoroscopy guidance, but now we use the transesophageal echo or intracardiac echocardiogram.
Yeah.
So in my practice, in almost most of the BFO cases, we use the intracardiac echocardiogram, in which the patient doesn't need to be sedative, so you can do it without sedation to the patient, and it gives you also very nice images, including 3D with the eyes, new catheters. In other cases, which we think it might be complicated with multiple defects in the same patients, for example, like the patient who presented today, I tend to use a transesophageal echo guidance to have the optimal result for those patients.
Yeah. So you still can use TEE. So standard is ICE, but In selected cases, you opt for TE.
Yes.
Okay. After the device is implanted, what medication patient should go on?
Yeah, that's a good question. So usually we load the patients pre-procedure with the dual antiplatelet therapy, mainly aspirin and Plavix, and then we keep them post-procedure s- for 1 month on dual antiplatelet therapy. Then I continue single antiplatelet therapy for 6 months. So the different expertise, they use different formula, but this is usually the standard care for those patients.
Is there any final questions about post after discharge?
Yeah.
Does the patient require any echo or another TE?
Yeah. So this is considered one of the minimal invasive procedure, and that's actually one of the good advantages compared to open heart surgery. So patients can go home next day and sometimes even same day in the evening in case of BFO. But of course, we have to do an echo before discharging the patient, just to make sure that there is no, like pericardial effusion, or make sure that the device is well seated. And then after that, we advise the patients, to take it easy in terms of an exercise for at least a month. And of course, we follow them up in the structural clinic. After 3 months, we do an echo, and then patient, they don't need usually follow up on a regular basis unless there is an indication for that.
Yeah. Dr. Fahad Alkindi, thanks again for walking us through a very comprehensive overview of atrial septal defect in adult.
It's my pleasure.
Yeah.
Thanks.
Watch
Thanks
these
for
videos
the-
and others on the YouTube channel as well as on the website. This is Chadi Alraies coming to you from Riyadh Structural Heart Conference in 2025. Fahad, thanks again.
Thank you.